The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
So let's talk a little bit more about aspects of mental stress. Notice that aspects of mental stress can ultimately lead to disorders related to your heart, right? It can ultimately lead to concerns about your heart. Let's talk a little bit about outbursts of anger, right? Outbursts of anger. Notice that in this specific case, outbursts can be considered typically dangerous because you are in an elevated state, right? When you have an outburst of anger, notice that your heart, your blood pressure, everything has been spiked in that moment. So notice that, yes, you could be at an altered risk of a potential heart attack or coronary disease. Now, if we look into depression as a risk factor, I should say, for heart disease, notice that you are, because you have a mood disorder, right? You have an emotional dysfunction. Notice that that emotional dysfunction that comes from this mood disorder of depression can also lead to heart disease. Notice that depression puts you at a much higher risk of heart disease, double the risk of the average person, right? So if you have depression, chances are you are at a much, much higher risk of developing a heart disorder. Something really interesting about mental illnesses, particularly stress or responses to stress, is that it will affect your immune system, right? If you recall from our previous section, in our previous lecture, we talked about the general adaptation syndrome of stress. So you can only be exposed to stress so much before it's helping you increase your performance to actually decreasing your performance. So think about that big final, right? A big final coming up, right? That is going to elicit an amount of stress that hopefully that amount of stress is going to help you in, okay, I need to study, maybe make an appointment. But notice if you have so much stress, it will start decreasing, right, exponentially, right? So your well-being, your response levels are going to start decreasing. That comes at a cost. It will come at the cost of an impaired immune system. Notice that the intent of the immune response is to protect you, right? Protect you from foreign agents, for example, bacteria, viral agents, or just simply any foreign substance. The situation is that generally when we are exposed to stress, your immune response is going to start decreasing. So think about a time, maybe yourself, that you were really stressed out at work, or maybe stressed out in school. You have all these finals, or you have a big interview coming up at work for a promotion, and then you get the flu, and then you get sick, or then you get a stomach bug. That's not a coincidence. It's because your immune system has decreased. Your ability to defend yourself against foreign agents has decreased because of stress. You're thinking, I notice that would increase the chances of you getting ill or you getting sick. Let's think a little bit more about long-term stress. The reason he couldn't get sick is because he could not get sick. So you're thinking right now, I have so many finals to study for, and then whoops, now you get the flu or you get the fever or something like that, or stomach bug, well, particularly because you're stressed out. Yes, ma'am. So think about your response, right? Remember, we talked about the general adaptation syndrome. When you are responding to stress, stress is seen like a threat, right? Your hormones are going to respond to this threat. So you have adrenaline, you have cortisol, you have neurotransmitters. Notice you're going to, because you're exposed to this stressor, your ammunition, right? So your cortisol, your hormones, things that you would normally use to defend yourself against a stressor, they're going to be depleted. You're going to run out. Eventually, your body can only resist so much stress before your resources, both mental and physical, start depleting. So that's one reason why the immune system starts basically becoming weak, because you are responding right now to a stressor, right? But it's going to get depleted, especially if you're not eating, sleeping, taking care of yourself. So eventually, your resources are going to become depleted. And now, if you are exposed to, say, the flu virus or something like that, you're going to have less of a chance to be able to fight that flu virus compared to someone who actually managed their stress a little better. It doesn't mean that the other person can't get sick, but you have a higher risk of getting sick than that person because you have gassed out, you have run out of resources, hormonal resources in your body. Does that answer your question?
Yes.
Good deal. Fantastic. So let's revert back to our slides. Notice that when we are exposed to long-term stress, right? Long-term stress, this is going to promote chronic. And every time you see the word chronic, I want you to think about long-term, right? Long-term, not necessarily severe, but long-term. You're going to start becoming inflamed. And inflammation, particularly that of the heart, is a significant contributor to heart disease. Notice that also chronic inflammation can lead to other aspects. So I know we've been talking about coronary disease a whole lot, but notice that you can start developing other concerns. So for example, arthritis, respiratory diseases, and even some forms of cancer, right? So any questions about that?